Greetings. This is a case for the prosecution of the CDC, Center of Disease Control. We're going to be taking a look first at the first COVID-19 case in the USA. So let's take a brief look at the CDC's first involvement with the new coronavirus, then called 2019 nCoV, new being nouveau, CO meaning coronavirus, which means it was in a class of viruses that we're pretty familiar with, and V is for virus. 2019 is the date. It popped up in December of 2019. Probably you recognize this virus pod and robot because it was all over the news. The virus pod is actually a hospital bed with a little tent to keep other people from getting infected, and he didn't stay in that. He was just transported in that. They also have the same facilities for airplanes and helicopters and, all kinds of things. So the robot was caring for America's first case, a 35-year-old who had just returned from Wuhan, China. So this is a synopsis of the case coming from the New England Journal of Medicine. So I decided that's pretty reliable, and all this information is together in one place. I don't have to look it up. So I'm going to use this to go over exactly what happened. This is a review of the first case by the New England Journal of Medicine, very prestigious medical journal, and a much better source than the news media. So that you can pause these screens, by the way, and read the case if you want. The first American patient went into an urgent care facility in Snohomish County, Washington, in the Seattle area. These are the epicenter in Washington are three counties. Snohomish and King are two of them. I forget the third one. He disclosed that he had returned from Wuhan. He was tested for known pathogens. So we're trying to figure out what kind of virus do you have so we can treat you. And they all came back negative. He didn't have any of them. The patient worsened on hospital day 3 when the oxygen level went down, and that was due to having pneumonia developing in one lung. On day 6, the hospital requested the use of an antiviral drug that had not yet gone to clinical trial, and that's remdesivir, which was administered on the evening of day 7. So the guy's in relatively bad shape. He's coming down with a pneumonia and his lungs having trouble reading, oxygen level way down, and virus like flu symptoms, but they can't figure out what it is. The patient condition improved drastically on day 8. So after taking this drug, the next day, much better. And actually all of the symptoms were gone except for a cough on the very next day. And he took the drug the evening of the 7th, the day 7, I mean. So could this first case in the U.S. have been a clue to the CDC that the process of requesting a coronavirus test kit from the CDC, getting approval, getting a test kit, sending in a sample, could it have been a clue that this wouldn't work with several thousand people? It works okay with one guy. It would never fly with several thousand people. It should have been a clue to them that something's wrong with your policies and procedures. CDC failure. First one. Fundamental guidance from the CDC. So why are there so many people out there wearing the wrong mask? And why is there no CDC guidance? Well, there actually is some guidance. It's published online, but unless you're searching for it, you're not going to find it. And sometimes, your local news crew will have a spiel, a little story about, what kind of mask should you be wearing. And these are just some masks I took off of, the internet. These two on the left are, I think, from the same video where, people in China, I guess, or maybe they're in Korea, South Korea. Upper right is that doctor who unfortunately died. He's the initial whistleblower for coronavirus, saying, hey, we got a new virus, and basically him and I think there were 5 others or 6 others. It seemed to me there were 6 people altogether. Were arrested and charged with, spreading rumors, basically. Lower right, we have an American girl in Chinatown in New York wearing a mask, like a designer mask. So you see all kinds of different masks, and nobody really knows what to wear. But these are not the right kind of masks. So this DuPont Tyvek that you see here and the 3M one, they have exhale valves. So that means you can breathe in and filter the air in, but when you're exhaling, it's not filtered. It's going through a little diaphragm. And when you exhale, the pressure of your breath coming out opens the diaphragm and lets you exhale. That does a lot of good things if you're working in an environment like spraying stuff, or it makes your goggles not fog up because it keeps your mask cooler. But it's not made for coronavirus. So here's a chart on the right about, this is 3M saying, hey, these would work. So you have a model 8210, which is very common. I actually have a box of these because I have a shop in the basement, just a hobby woodworking shop, just a 700 square foot shop. And then you have a N95 respirator 1860. This is a surgical respirator, which the big difference between the 8210 and the 1860 is that the 1860 will not let liquids pass, which you don't really care about too much if you're worried about a virus. So that basically, surgical masks were designed to keep doctors from getting infected by the patient, and to keep the doctor from sneezing or something on the patient while in surgery. That's why they're a surgical mask. But they have to meet specifications for passing liquids. And if you look at the lower left, you can see on the chart, you can see that these are resistance to medical face masks by penetration by synthetic blood. In other words, they squirt the mask with so much pressure, like the doctor cut an artery, and it got squirted in the face, and this kept him from inhaling the blood because he could have been working on somebody with really nasty stuff. So that's the big difference. And on the right is a surgical respirator also. These are all respirators, by the way. So here's a close-up shot of these three masks. So you have an 8210, which is an N95, and you have the 1860, which is a surgical mask, which is also good for liquids, and then you have the one on the right that's also good for liquids, and it's just a little bit more surface area. So all three of these would work. They don't have an exhale valve. So when you exhale, your exhaled breath is going through the filter too. Now, if you have 40 people on a bus and everybody's wearing a mask with the exhale valve, and say 10 people are infected, everybody should be fine. It shouldn't be that big of a deal because everybody's protected from inhaling a virus. But if somebody on the bus has been wearing the same mask for a month and comes home every day and vacuums it to get, to make sure it's clean, and has taken half of the, the mass of the mask, went up in the vacuum cleaner, and it's not doing him any good anymore, or her any good anymore, then that person can surely get the virus from one of the 10 infected people because they're exhaling coronavirus. Okay, so, and then there's all kinds of masks that'll work. And there's actually a good CDC guide, and you can click on any manufacturer and see all the list of masks that they do approve. But the thing is, this isn't presented to the public very often. Only your local news crew or newspaper would, if they choose to, cover a story like that, they'll do it. What about eye protection? Did you hear anything about eye protection? You're not supposed to touch your eyes, with anything, because your hands are touching public surfaces all the time. You're hitting buttons on an elevator, and you're turning doorknobs and stuff like that. So don't touch your eyes, because your eyes can pick up the virus really easily. It's like an open port to your inside of your body. So what about eyeglasses? What about ladies' eyeglasses? They're pretty big. They cover, the style right now, is pretty big. Men's, not so big. So these are, very small, and there's a lot more possibility of air getting through. So if you wear the ladies', eyeglasses, are they okay? Are the men's not okay? Are neither one of them okay, and you need something you need to wear something over them that covers them? Nobody knows. And here's goggles. This is like over eyeglass goggles. Are these needed for any of the glasses that we saw, or anything that you might be wearing? Or do you not need any goggles? Who knows? So here's, just three things. You have masks on the left and eyeglasses and goggles. Have you been told anything about these? You would have to research it to find the answer. So that's another failure of the CDC. This information, it's just not getting out. COVID-19 testing in the USA. Maybe you've heard something about this. It's not all good news. So this still remains the biggest sign of the CDC's incompetence. The CDC proved their incompetence when they failed to produce enough COVID-19 test kits at a time when other countries were pumping out test kits by the zillions. Okay, the global press noticed. How did they notice? They read the international press. Why is it so hard to get coronavirus testing in the U.S. right now? It's just everywhere already. How delays in testing set back the U.S. coronavirus response. And America's shamefully slow coronavirus testing threatens all of us and killed some of us. The incompetence of the CDC led to a severe shortage of test kits. That's been well documented. On the left, you have Fox News. CDC has tested 1,583. I don't know what day this was, sometime probably in about a week ago in March. Only 516 people were tested in California. Korea's has tested 66,000 people so far, and they can test 10,000 a day, and that number's up. We'll see later. Broken coronavirus testing process in the U.S. could have enabled COVID-19 to spread silently for weeks, experts warn. Exclusive coronavirus testing threatened by a shortage of critical lab materials. Why did the CDC not know about this? No guarantee you'll get tested for COVID-19 even if your doctor requests it. So these are all from, National Public Radio, Newsweek. The previous page was, Time, and, these are all, valid news sources sometimes. Okay, we're just going to highlight a story from the Washington Post, much like the last, section where we highlighted a story from the New England Journal of Medicine. So the Washington Post, which, you shouldn't always believe because they're anti-Trump and, they're pro-whatever. The CDC has been around since 1946, so it's not Trump's baby. He didn't make the CDC. He inherited the CDC, and this is the first time he's seen them in action, and, they're pretty disgusting. CDC committed a 6-week series of mistakes that cost American lives and proliferated a global embarrassment for the U.S. medical industry and for the entire country. We might not ever overcome this, or we might never overcome this. We're looked at as global leaders in the United States, but not anymore, especially the medical industry. So here's the Washington Post. They go through this. We're going to highlight some stuff on every page. If you want to pause the video and read the pages, then go ahead. The problem started early in February. In early February, we had what? We had like less than 10 cases, 5 or 6. Then China developed its own test kits, and so did Germany. And Germany offered to send theirs to us. Okay, so highlighted on the right here, we have CDC shared the details of the U.S. tests publicly on January 24th. We're the mighty CDC. We have test kits. We're sharing this information with you. The U.S. CDC announced the American tests on January 24th, and distributed only 90 tests. 90 tests, and then recalled them because they didn't work. And keep in mind, at the same time, South Korea is testing 10,000 people a day, and China more. The CDC was criticized for not using tests from more competent organizations in other countries. but that would require FDA approval. So this is another major mess up by the CDC, if you ask me. This is just unacceptable. I do a lot of government consulting. This is the worst organization I have ever seen in my life. They had issues with the FDA. The FDA would have to approve everything except for a CDC test. Well, the CDC tests were messed up. So how do we get out of this? We need something else, and it would have to be approved by the FDA. The CDC should have known that the use of foreign tests would not be possible. Decades ago, they should have known this. And they should have fought for regulation to change that instead of waiting for a pandemic. That's what they did. They waited for a pandemic. On February 13th, Secretary Azar testified before Congress that a limited 5-city pilot would be held. Okay, so this is mid-February, a limited 5-city pilot. Think about mid-February. China, this virus is starting to pop up all over Europe. We're talking about a 5-city pilot. The pilot should have been done in 2015, not this year. We should do stuff like that before the pandemic hits. February 13th, CDC announces a 5-city pilot for testing. February 13th, there was a huge spike. This is what else was going on in the world on February 13th. There was a huge spike. I've been doing these videos for a long time now. And there was a giant size spike, as you can see that graph on the left in the white with the aqua colored, teal colored edges. So in Hubei province, the tests increased 14,840 in one day. The positive cases, the confirmed cases. Why? Because they had another test procedure that they had introduced like a week before or a couple of weeks before. And it came up with a bunch of positives, and on this day, the 13th, they decided to add them to their stats that they publish. And if you can see the graph on the bottom, this is the Johns Hopkins graph that everybody uses, and you see that big, huge spike coming up on the 13th of February. So we're doing a 5-city pilot, and China has just added 14,000 new cases. Does that tell you there's something wrong? China's test, to get 14,000 positive cases, you have to test 100,000 people at least, or a couple 100,000 people. So next, the Washington Post hits on this. The COVID cases started appearing outside of China. But hospital labs are still barred from developing tests. Why? Because public labs because they knew that they would need CDC approval, so they're not even working on it. Think of all the research institutes and public labs and hospital research institutes, university research institutes that we have in this country. Tens of thousands of them. But nobody's working on anything because they knew they would need FDA approval. As a matter of fact, as days went by, public health labs became increasingly desperate. On the 25th, they requested special permission from the FDA, and much to everybody's surprise, the FDA decided, well, we can let everybody in America die, or we can change our policy. Actually, they kind of got around it. So on February 25th, U.S. had 57 cases, but we wanted to test hundreds of more people, and we didn't have any tests. So, that's what was going on February 25th. Then on February 29th, the FDA announced a new policy making it easier for hospitals to develop tests. Now, the reason that they were able to do this is they kind of got around the law, the way the policy was written. And that's because the original CDC test had 3 parts. Part 3 was bad. So if the CDC would allow these labs to redo Part 3, they could still say, hey, it's a CDC test. We don't need FDA approval. So that's basically how they got through. But the damage is already done in the reputation of the CDC and the American health industry. It's bad. The CDC should be shut down. We'll get over that. We'll get into that later. So on February 29th, the U.S. had 70 cases, with hundreds more suspected cases that cannot be tested. The LA Times, they ran a story this was just a couple days ago, March 15th. She couldn't get a coronavirus test in the United States, so she flew back to China. So this is typical California. You know, they're saying, this lady couldn't get a test here, so she went back to California. Well, she ought to be arrested and thrown into prison, and they should throw away the key. That or should put her on an inner tube and send her to China. You don't, this reminds me of the person who left Wuhan to go have dinner in Paris, and she knew she had coronavirus. She already tested positive, but she took some Chinese drugs to lower her temperature, so she got through the airport okay. And then she went to Paris and then shot a video on WeChat and said, "Hey, here I am having fun, drinking with my friends, and I have coronavirus." That's insane. That's Chinese behaving badly. You probably heard a lot about that. But anyways, this LA Times ran this article kind of making you feel sorry for the woman. Well, I don't feel sorry for her. She ought to be shot. Former director of the CDC wants an investigation, and so do we. So here's a former director saying, what the hell is going on? Something's wrong. He wants an investigation on these testing failures. LA Times, problems mount with coronavirus testing, limiting access and sowing confusion. Massachusetts firm to produce millions of test kits that can diagnose COVID-19 in 4 hours. And it came out on 3/15. So now that we have permission for some laboratories to start developing their own test, and that's really only part 3, from the CDC test, we have a lot of labs that can make tests in the country now. So the CDC was bound by red tape, insane policies, insane regulations, and the CDC did nothing to change anything. They just waited for a pandemic to hit and said, "Oh, we can do a pilot in 5 cities, but we need 10,000 tests today. We don't need a pilot in 3 cities." Meanwhile, other countries working organizations pumped out COVID-19 tests by the zillions. Why couldn't the CDC see and resolve regulation issues before a pandemic hits the United States? So here's a little thing I made where it shows the CDC on top, and they're kind of blocked by the FDA from working with university research institutes, hospital research institutes, private labs, and foreign labs. This is a German lab on the right, or the upper right, that little picture where they developed a really fast test and they wanted to sell them to America, but we can't because we have the FDA. CDC failure, any way you look at it. They should have known this stuff. They should have known they wouldn't be able to get tests from anywhere else in the world if we couldn't make our own. And we can't make our own because the CDC screwed up and we don't have the capacity to make them without these laboratories. And we're not allowed to use the laboratories. This is just insane. It's like a 12-year-old, designed the CDC. COVID recoveries in the United States. Let's take a look at some of the numbers for coronavirus recoveries in other countries. So let's take a look at some numbers for coronavirus recoveries in other countries. Here's China. So we're using the Johns Hopkins Research Institute, the Center for System Science and Engineering. And they've been using this global tracker, and everybody on the planet uses this tracker now. You can see it in my other videos. That we had a bunch of Germans in a room talking the other day in Berlin, and the screen was this global tracker by Johns Hopkins. It shows up everywhere. So China has 81,000 confirmed cases and 67,843 recovered. That's an 84% recovery rate. How is China getting all these people to recover? Well, a lot of people just recover on their own because most people aren't affected very much. Children hardly affected at all. And some people they're curing in the hospital, but not very many. Most of this 83.74%, probably 80% cure themselves. Italia. So this is a country that's really whacked up right now. Total confirmed 24,747. Remember, China was 80,000, so they're getting up there. Total deaths 1,809. That's the most deaths outside of China. That's more deaths than every other province in China combined, except for Hubei province. Total recovered 2,335. But at least they have some people recovered, 9.44%. This is Spain, 7,800. And this, I think this is 2 days ago, the information I'm using here. Total deaths 292. Total recovered 517. That's a 6.7 or 6.6% recovery rate. And then we have Japan, 839 cases, 144 recovered, 17.37% recovery rate. Then we have Singapore, 226, recovered 105, 46%. And then we have the cruise ships. This is in Japan also, but these are not Japanese people. These include Americans, and everybody who basically was on the cruise ship who tested positive went to a Japanese hospital. And that number was up around 900, and now it's like 700. So some people have recovered from the cruise ships. 325 recovered, so that's 46.7%. South Korea. Now, South Korea's recovery rate isn't that high because most people in South Korea haven't been infected that long, because this came up all of a sudden. You can see the city on the lower in the southeastern part of the country to the right of that red ball or red circle is Daegu, and that's where the breakout occurred due to that crazy Christian church. And it's hard to contain people because, like on the first days, one woman infected like 40 people on the first day. So it just went infection crazy, and it went up. Korea went from very few cases up to several thousand in just a few days. But since then, you don't see much happening with Korea. They're pretty much holding, adding just less than 100 cases a day, less than 50 cases a day. That's in my other videos. Then we have the US of A. What do we have? We have 3,774 cases now. Right now, I think that's up to 4,600. 69 deaths, that's up to 85, and we have 12 recovered. I think that's 17 now, but 12%, that's 0.32% recovery. We're an embarrassment. 0.32%, 12 out of 3,774. That's crazy. Crazy bad. So, why is the CDC investigating this problem? No, probably not. Are they curious about the coronavirus recovery rate? Is the CDC doing anything to investigate this issue? Is the CDC making sure that hospitals have the latest and best drug treatments? The rest of the world is getting people out of the hospital. We still have thousands of people in the hospital. Just about everybody who's gone into a hospital is still there. Is the CDC aware of the numbers of deaths in the United States? 85 now. Is the CDC doing anything to investigate the deaths? No. What are they doing? They're the Center for Disease Control. Why do we have the lowest number of recovered patients in the world? Why do we have, like I said, everybody who goes into a hospital with, COVID-19 stays there. Nobody gets out. Is that a problem? You're the Center for Disease Control. Why don't you tell me, is it a problem? So now we're going to consider, a hot spot in the U.S., the Seattle area, King County. We saw Simonish County earlier, and I think the other one's Pierce, and we'll get to that. King County reported 6 new deaths that have been linked to COVID-19, and the number of fatalities jumped to 48. 769 total cases of patients who have tested positive. Most of the deaths that have been reported in King County were linked to the Life Care Center, a nursing home. And on the lower right here, you can see of the 35, this is a couple days earlier than this, so the numbers might not match. Of the 35 deaths reported in King County, 27 are associated with the Life Care Center. 47 staff members tested positive, 24 tested negative, and there's still 18 staff members to be tested, but there's not enough kits to do them. CDC published an action plan for the 3 counties. Yes, it's Seattle, King, Pierce, and Snohomish County. I say that wrong sometimes. Snohomish. The CDC published an action plan for the 3 counties in the Seattle area, but does anyone listen to them? Because they gave us a pandemic, I don't know. But anyways, the CDC published an action plan and then decided, you guys aren't following all of our guidelines. So this is the action plan. And then I made some graphs. So the bar graph on the left shows you the total number of cases and recovery. So China has, a lot of, orange cases where they're still open, and blue is recoveries. Oh, no, I'm sorry, the other way around. Blue is confirmed and orange is total recovered. So China has a huge number of total recovered. So, and then Italy, you can see Spain, Japan, Singapore. See, the problem with including China is they have such big numbers, it makes all the other countries look small. So I took them out, and that's the graph on the right now. Plus I separated it into 2 bars. So Italy, you can tell almost 25,000 cases. And I think this might be data from the 16th. Spain, Japan, Singapore doesn't show up because their numbers are pretty small. Cruise ships show up a little bit. South Korea, US, our cases show up, but there's no sign of recovered. Because why? Because we don't have any recovered people. Because why? Because we have the CDC. So the number of recoveries does not show up on these graphs. Then I made a graph with percentages. So on the lower left is just the recovered cases. These are numbers, total number of recovered cases by country. Same countries. And the U.S. has, they're not showing up because we only have 15 recovered people now. Actually, I think that's up to 17 now. And then on the right, this is percentages, going from 15% to a couple of places, almost 50%. And I took the scale out on the right, and that orange line still shows up. I don't know why. So this is, all the graphs, together, just showing you the same thing. U.S., how we compare with other countries in the world. We're terrible, 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 crazy bad. Why isn't the CDC doing anything to get thousands of Americans out of hospitals? Okay, so we have 12 recovered now, and like I said, I think that's 17 now. 69 deaths went to 85. And that 3,700 number went to 4,600. Some of these screens are a couple days old. So why aren't they doing anything to get Americans out of hospitals? Just think of how many Americans are still in hospitals. Everybody that goes to a hospital for coronavirus is still there. They're going to die there. They're going to miss the elections in November. They're going to miss Christmas. They're still in the hospital. Crazy. Why are they still in the hospital? Why do we only have 12 recovered people or 17? That's just crazy. Is the CDC doing anything? Do they even know about it? So, more craziness, another CDC failure.